Hi everyone, welcome to my channel. I'm Dr. Zonna. Today I'm going to discuss heat stress and stress in general and how it affects the health of our kidneys. I want to share some studies about it, what are the foods to eat, and how do we keep our kidneys healthy and happy. Summertime, tropical countries, and extreme weather, hot or cold, indoor and outdoor can play a role on how our renal system operates. It could potentially be the reasons that lead to failure if we are not careful. It's very important to keep our kidneys healthy. Signs and symptoms that kidneys are not in good shape may include muscle cramps, itchy, dry skin, sleeping issues, appetite loss, urinating either too much or too little, nausea and vomiting, swelling on the feet and ankles, shortness of breath. Hydration is an unpopular topic and not discussed much. It's important to increase fluid intake, drinking water to quench our thirst, but not to overdrink. Not drinking enough water can also give you a bad breath. It's crucial to drink enough water so the kidneys can properly flush out any excess waste materials and maintain a good total amount of body water it needs to keep us functioning well. When working a stressful job or physically demanding, especially in the heat, it's easy to forget to properly get hydrated. Inadequate or no toilet access can be an issue as well. Not stopping to use the bathroom could lead to a dilated and poorly functioning bladder. Environmental factors can affect the kidneys and may lead to increased risk of having kidney stones. Decrease in urine output and increase in urinary calcium and phosphate excretion are issues that relates to kidney stones. The risk increases when working in hot environments indoor and outdoors. Healthcare workers such as nursing job, working as a cook by being constantly exposed to high heat indoor, driving for a living poses a higher risk due to poor hydration and delaying bathroom visits. There are so many herbs recommended to keep the kidneys happy. Personally, I like lemon juice, ginseng, green tea, ginger, turmeric, garlic. Sometimes I use honey to sweeten them, but mostly I just drink it by itself. But water is the best for kidneys and give a very good hydration. Lack of rest and strenuous physical activities lower productivity and may result to hydration issues, in which fatigue, headaches, and weakness may be experienced. Chronic kidney disease of unknown origin, CKDU, is common in tropical or hot climate. It's considered as unknown origin since its traditional risks, hypertension, and diabetes are not known to be associated. Adequate water intake is hard to measure. However, signs of inadequate water intake can be evident by three factors: observing your thirst perception, urine color, and acute loss of body weight greater than 1%. You can check this first thing in the morning. This indicates decrease of total body water. Combination of these two factors is very likely that fluid intake is inadequate. Appropriate nutrition is vital for our organs in general. A systemic study revealed that a healthy diet comprising of legumes, fish, whole grains, cereals, many fruits and vegetables, nuts and fibers, and also cutting down on red meat, sodium, and refined sugar intake was associated with lower mortality in people with kidney disease. Foods that are low in saturated fats and sodium was associated with lower rates of age-adjusted all-cause mortality in individuals with chronic kidney disease. Numerous studies confirms that the Western diet, also known as meat-sweet diet or standard American diet, characterized by high content of high-fat foods, high sugar desserts and drink, red meat, and refined grains, is not beneficial for health and associated with obesity, cardiovascular complications, colon cancer, osteoporosis, and chronic kidney disease. Excessive or high fat and high cholesterol intake are bad for the kidneys. Stress and smoking are also associated with the health of the kidneys. A kidney-friendly diet to protect from its damage needs to be of importance. A plant-based diet is preferable. It also improves blood pressure. The Mediterranean diet, based on consumption of fruits and vegetables, whole grains, legumes, nuts, olive oil, herbs, and spices, and limiting red meat, has a low phosphorus content and has been shown to reduce plasma homocysteine, serum phosphorus, microalbuminuria, and cardiovascular risk. Huang et al.'s study demonstrated that adoption of a Mediterranean-like diet was associated with better kidney function, while low adherence to it resulted in poorer survival rates among individuals with chronic kidney disease. Mediterranean diet may deliver relatively low contents of salt and phosphate, which positively influence survival in the chronic kidney disease population. Increase in salt directly causes renal damage. There's a need to observe a low-sodium diet, especially if your kidneys are not in good shape. Proteins also play an important role in kidneys. Moderately restricted low-protein diet suggesting that very low-protein diet prolonged dialysis-free period by at least 1 year, even in the presence of a more severely reduced residual renal function. Numerous studies also indicate that a diet low in saturated fatty acids is beneficial for a healthy kidney, especially with chronic kidney disease. Also, a very low protein diet supplemented with amino acids and keto acids (SBLPD) was found to be safe and advantageous for patients with chronic kidney disease, especially at stages 4 and 5. It corrects proteinuria, blood pressure, and hemoglobin, and therefore it may prolong not only the dialysis-free period but also the survival. However, switching diets should be carefully consulted with a nephrologist and monitored by a dietitian to avoid nutritional errors which can accelerate kidney function deterioration. In the United States, the incidence and prevalence of kidney failure are rising. The outcomes are poor and the costs are high. It's projected that the number of the persons with kidney failure who are treated with dialysis and transplantation will increase. Kidney disease is a worldwide public health problem. Early-stage kidney disease is asymptomatic. Laboratory measurements are required for its detection. The American Diabetes Association and an earlier position paper by the NKF recommend assessment of proteinuria to detect chronic kidney disease. Normally, the body excretes very small amounts of proteins in the urine. Increased excretion of albumin is a sensitive marker for chronic kidney disease. Serum creatinine concentration is also assessed. It shows the level of kidney function by using prediction equations taking into account age, sex, race, and body size. GFR, or glomerular filtration rate, can be estimated from serum creatinine levels. If the personal physician cannot adequately evaluate and treat the condition, it's recommended to see a nephrologist, a specialist that should participate, especially with a GFR less than 30 ml per minute per 1.73 m squared. So to maintain a good healthy kidneys, make sure to have good hydration, do not delay your bathroom visits, and consume kidney-friendly diet. I hope you learned something today. Please support my channel, like, subscribe, and share to your family and friends. Thank you so much for your time spent watching. Please stay tuned for my next topic and hope you check out my other videos as well. Take care and always stay happy and healthy.